Today we're going to talk about jaundice. So let's get jaundiced.
I'm Dr. Lastra, pediatrician at Head2Toe Pediatrics. And if you've been following along, you know that this month we're focusing on talking about babies. And jaundice is something that every baby gets. You may have heard of the term jaundice. You may have heard of the term bilirubin. You may have heard of baby skin turning yellow, such as the color of this paper. But baby skin could also turn orangey, such as the color of my background. So all babies get jaundice. That's the normal part of being a baby. And one of the reasons why babies get jaundice is because they're making and breaking down a lot of red blood cells when they're born. Bilirubin is a pigment inside of the red blood cells, and when that pigment gets released into the bloodstream, when those red blood cells break down, it causes the coloring of the skin, so the yellowing or the orangey color of the skin. The other important reason why babies get jaundice is because their liver is still not fully functioning, and that is common for babies because it takes time for the liver to reach its full capacity, which is usually around 2 weeks of life, but it varies with all babies. So while the liver is still trying to figure things out, it can't grab that excess bilirubin or that bilirubin that's in the bloodstream to dispose of it in the form of poops. So that is the reason why all babies get jaundice. So because of this, we always check newborns for jaundice. And if you watched my last video, you know that one of the ways that we check for jaundice is with a bilimeter, which is a little tool that flashes a little light, and we put that on the baby's chest and we get a measurement. We get the measurement for the bilirubin level. We can also do a blood draw to check for what the bilirubin level is on a baby. And every hour of life, that level changes and it really varies. So we use different tools to determine, based on how old the baby is, what that level of bilirubin that we allow to be in the safe zone and what the level that we would consider to be in the watching zone and what the level that we consider to be in a treatment zone. So if you hear from your pediatrician that your baby's jaundice is great and that they don't need to do anything else to monitor, that usually means that even if they have a little bit of bilirubin or a little bit of jaundice, that level is within that safe zone. If you hear that from the doctor that, oh, your baby's bilirubin, we just need to keep a close eye on it and we're watching it, that means that it's probably in that middle zone where it doesn't need to be treated, but we do need to keep an eye on it. And if that bilirubin is in that treatment zone, which is the zone that we worry about, then that means that we have to treat. And like I said, I can't give you values because the values really vary based on the baby's age and a lot of other factors that determine what kind of risk category the baby's gonna be placed in. But what's important to know is that if the bilirubin gets too high, that can sometimes deposit in the brain and cause issues for the babies and as they grow older, which is why we treat it. So treatment involves, the most common way is phototherapy, which is when we shine bright lights on the baby to help bring that bilirubin level down. If that's not working, there are other levels of treatments that we will not be going into in this video, but you should definitely talk with your pediatrician about if it is something that you're concerned. For the lights, the image of the video photo is going to show what that bank light looks like that we put on babies. So take a look at our photo for this video so that you can see what that looks like. So this light shines on the baby. We put cute little eye mask on the baby to protect their eyes while they're under the lights. And typically when I put babies on lights, if everything else is completely normal and things are going the way we expect them to, they don't tend to be on the lights for longer than 24 hours is the most typical. But that can really vary. So that's just most usually what I tend to see in my practice. There's also a Billy blanket that you may have heard of. And with the Billy blanket, that is something that babies can go home with and can do the phototherapy at home with the Billy blanket. If a baby's gonna need Billy lights, like overhead lights, they have to be in a hospital in order to get that treatment. Some babies respond well to the Billy blanket and can stay at home throughout the course of their phototherapy. And let's see, so that is the main way that we treat for the jaundice. If a baby is in the medium risk where we're kind of watching, the best thing that you can do at home to help that jaundice level go down is to feed your baby. Because the more baby feeds, the more pees that they get and the more poops that they get, that's the way that they get rid of that bilirubin. So pees and poops are a great measure to see if your baby is doing a lot of those, to know that that's helping to bring down that bilirubin. You may have also heard from some people that you should put your baby under the sun to help with jaundice and that that'll bring the jaundice down. There's no real evidence to suggest that that helps, and it could cause more problems. So I wouldn't suggest putting your baby out in the sun to soak the sun. What you could do is inside of the home in their little diaper, you could put them in front of a window that gets some direct sunlight, but that sunlight is being passed through a window, and you want to make sure that it's nice and warm in the home. You don't want it to be too cold because you don't want babies' temperatures to be going too low or being too high from the heat or being in a cold environment. And I can't really say that that helps, but it sometimes helps parents feel better because they feel like they're doing something. But again, definitely feeding, pees, and poops are definitely going to help bring that jaundice level down. So that's like a quick intro into newborn jaundice and what things to expect and how you can help lower your baby's jaundice level. Most important thing is to remember that all babies get it, and it's important that we watch during that newborn period. If you have any questions, let us know, put them in the comments, and we'll be happy to answer those. Bye.